first and foremost, I'm a social worker. So I believe that, that type of accessible healthcare should be readily available to every person.
Why is the conversation we're having now today about wound care specifically, why is it more important now than ever?
We're not just healing wounds, like you said. We are giving people access to their life again.
Tell me a little bit about your why.
Hey guys, a quick moment of your time. First off, thank you. A heartfelt thank you for finding and joining the Aging with Innovation podcast, where we have valuable discussions with professionals in the senior care industry every single week. Everything from specialized dementia program experts to non-medical and medical home health agency owners, all the way to geriatric physicians, functional medicine practitioners, and even mobile wound care providers. And really all geared toward helping seniors understand what's out there and available to them. And even so they can take some agency, apply some of these lessons and things that we discuss into their own lives to improve the quality of their health. And also just to get a better understanding of what service providers can do for them and what's available in their area. So if you could do me a quick favor, I'd greatly appreciate it if you can go on and subscribe wherever you're watching this show. It would mean the absolute world to me. Thanks again, and let's get back to the show.
All right, Brett, I am really excited to have this conversation with you. I know we had met a couple weeks back, and I wasn't sure it was going to lead to this or not, but with our discussion, we just opened to some things that I think are really important to be able to share with a lot of the other senior care providers that are in our network, with the seniors themselves as well. So the thing that I want to start out with, and we'll obviously get into your backstory and that sort of thing too, but what are the conversations that are going on kind of behind the scenes right now, maybe with your caregivers, maybe with the families that you serve, that are not maybe being talked about by every other agency out there?
Sure. Happy to share some of those. I think one of the biggest challenges that people have, I'll talk about the clients first.
Yeah.
One of the challenges that people have is knowing when to start care.
Okay.
And, there's a lot that goes into that. It can be a very emotional topic for the families and for the individuals. It certainly can be challenging because there's a financial component to that. But I think families do struggle with knowing when to bring care in. That's something that, they don't know when the right time is, and, they need trusted professionals to help them. I'm always happy to help educate them around what home care can do. I know aging life care managers can provide a lot of guidance around that, but knowing when to get started, I think, is something that people really do struggle with.
Yeah, maybe it'll be helpful too, just to define what type of care we're actually talking about here. Because for context, Assisted Hands Home Care, it's a non-medical home care agency serving Arlington, Alexandria, Fairfax,
Yeah.
Right? Now, tell me a little bit more, just, for those who may not exactly know, like what type of care is your team providing?
Yeah, sure. That's a great question. Maybe something I should have probably let in with, but we provide non-medical in-home care to primarily seniors. We do work with adults of all ages, sometimes with disabilities, and that really consists of personal care when people need assistance with the everyday personal care that we've done all of our lives, and someone's not able to do that for some reason. It also involves a lot of household chores that may need done: laundry, light housekeeping, meal preparation and cooking. And then there's other things that we can do, like helping clients get to and from appointments, whether those are medical appointments or social engagements that they have. We also can help with various routines and compliance with doctor's recommendations or post-surgical recommendations, or also discharge instructions that someone has. So kind of all of those are the way that I typically describe our services.
Right. Now, how would you describe maybe the difference between home care and, say, like skilled home health? Because sometimes I would reckon that some folks don't know exactly the difference or when to use one service versus the other. Like, how do you differ from skilled home health?
Sure. So, and that's a great question that I get quite a bit. I'm very deliberate when I'm describing our services as non-medical.
Sure.
And I do that for a few reasons, because the people that we have are they're certainly healthcare workers, but they're not medical in a sense that they're not a registered nurse. We're not providing any medical support. So we don't do things that are also covered by most medical insurance, Medicare being the primary one for our clients. And people call us all the time and want to know if our services are covered under Medicare or other health insurance, and they're not. For the most part, they're not. It gets very nuanced in some of the Medicare language, and it causes a number of confusion for a lot of our clients and people that call me for services. But that's why I describe it as non-medical, because we're not doing anything that would be done by a medical professional, and we're also not doing things that are typically covered by healthcare insurance.
Gotcha. So things like maybe wound care, blood draws, physical therapy.
We don't administer medication, PT, OT, speech therapy. All of those are done by Medicare, typically Medicare certified home health agencies, as opposed to a non-medical in-home care agency like us that's providing primarily activities of daily living. So,
Right. Yeah, I think both go hand in hand, because oftentimes those that have skilled home health, like they need help with their medication management, they need help with wound care, PT, OT, those sort of services, oftentimes need help from home care as well, because I would imagine this conversation comes up quite a bit, right? Where maybe there's the family is trying to help Miss Jones. She's 80 years old. She just got out of the hospital. She has home health, but skilled home health is only there for a very small portion of the week. What happens in that period of time when nobody's there? I mean, maybe you can expand upon that and just bring some light to this, and like who is specifically using your services.
Sure, TJ. So the way that I kind of think about it is when the situation you were describing, when somebody needs both the Medicare certified home health agency, so the skilled care versus the non-skilled, often happens after someone is discharged from hospital or rehab facility.
Sure.
And in those cases, something like the PT and OT, I'll use as an example, that can be done on a schedule. The home health agency can schedule that. It's usually 1 or 2 visits per week, something along those lines. And it's also done maybe 2, 3, 4 weeks, depending on the objectives that individual has. We would be providing support with the non-medical work, the activities of daily living, and those are things that are harder to schedule for, because if someone needs assistance with toileting, for instance, they're going to need assistance when they have to go to the bathroom, and you can't necessarily schedule that like you would a PT or an OT visit. So when there's a need for a client to have both, they often need quite a bit of non-medical support like we would provide, maybe from 8 in the morning until 6 p.m. or 8 p.m. And it's hard to also just throw out hours. What we really try to do is anytime we start working with someone, we start with an assessment so we can understand what their care needs are. And that assessment and those care needs that we identify, that's really how we help determine the client the best schedule that can meet their needs, and also work within their budget that they're dealing with.
Right.
Because there's always like I mentioned earlier, there's a financial component to it.
Yeah, and I think it's always good to clarify and just maybe start on that point there. Like, what is home care versus home health? Who is appropriate for care? How do you determine the number of hours? And those, I would imagine, are pretty intimate conversations that you're having with the family, with maybe the client themselves, to determine what actually is the need.
Exactly. So, we start working with people in a variety of ways. Sometimes people, and this kind of goes back to what I initially said, when is the right time? Mm-hmm. If maybe family members realize that mom or dad is not necessarily able to do some of the things that they were able to do before, they may reach out to a company like us and say, hey, Brett, can you come help us? I've noticed this about mom or dad. They're not getting dressed as much. They're sleeping later. they're just not doing the things that they should be doing. That tends to be a little bit more of a gradual approach. We can do an assessment. It's not a, you have to get started tomorrow type thing,
Right.
but we want someone to come in soon. That often also tends to be maybe a duration of, they need someone to get started with the day, so we're working from 9 a.m. to 2 p.m. or something like that, and they don't need support for the rest of the day, because once they get that support to get the day started, they're okay. An alternate scenario would be there's a fall or an injury or something along those lines.
Right.
And that kind of goes down the path that I was talking about earlier, when someone is in the hospital, then they go to a rehab facility, and after that, they're going to discharge home. And they do need support right away. And the care needs are typically different, because somebody that is recovering from a fall, maybe they have a broken hip or something along some injury, that they are going to be fairly limited, at least for a brief period of time. They're going to need those services from a home health agency you described, but they're going to need a support, unless a family member is able to supplement that, they're going to need support probably at least for the first week or two, from the morning through the evening. And then that's when we might be working, say, 8, 10, 12 hours a day, helping with most of their activities of daily living and keeping up with their home, the cleaning and the meal preparation, laundry, and things like that.
Yeah, I think that's, it brings a lot of clarity, for the folks listening out there. One thing I know to be true is that there's a lot of home care agencies in the Northern Virginia area, and I think there's a need for it. What I'm curious about is, you've been in business, I know, since 2018. You didn't come from healthcare. You had a different career before this, yet you've had a tremendous amount of success. Well, kudos to you and the work that you've done since 2018 until now. Tell me a little bit about your why. Why did you get into this industry in the first place and go down this path of creating a meaningful business here for seniors?
Sure. And thank you for recognizing the success. I mean, I don't know that I would necessarily describe it like that. I mean, sometimes I feel like we're still in the process of helping people and continuing to grow our agency, and I'm glad that people can notice that. The reason I got into this work, I was a CPA, or I was an accounting major in college, so I kind of followed the normal progression for an accounting student. I got my CPA, I did several years in public accounting, then I did several years in consulting, and ultimately primarily focused on the financial services industry, so banking and financial companies. I like the work, but I don't feel like I had a connection to the work. And as my career progressed, I wanted to have just a stronger connection to the work that I was doing. I wanted to feel like I was driven by the purpose. And I was very close to the elderly people in my life. 3 of my grandparents passed away very early, but the other 3 I was very close to into my early 20s.
Wow.
And I cared for my grandfather on my father's side after a stroke for about a year. So I had hands-on experience in being a caregiver. And then on my mom's side, her mother had dementia, and I watched my mom care for her for 10 to 12 years before she passed away, and saw it was also back in the 1990s. I don't think, as a society, we probably knew as much, or there was as much information about dementia, that things that people are challenged with.
Right.
It's kind of crazy to me to think back to how she, lived alone, and the condition that she was. I mean, she was well cared for, but I just see some of the things that I see now today. But that was really the motivation that led me to home care. And I knew that I could make a difference. I wanted to grow a business as well.
Yeah.
And I feel like it all kind of came together. And it's been a great decision. I mean, it's always hard starting a new business, especially when you're not from that industry. Not only did I not have senior care experience, but I didn't have a lot of healthcare experience either. So I had a lot to learn over the first 2 to 3 years. But it's been a great journey, and I think we're still in the middle of it. So
yeah, no, I don't think you've peaked by any means, but I do think it's nice to pause every now and then and reflect on success that you have. Because the reality is that most businesses in any industry fail. And home care, it can be a tough business. It absolutely can be. Yet, from 2018 until now, maybe those first few years were, like you said, it was a bit of a learning curve. There's the inevitable challenges that you face. Yet now, you carry a pretty high census of folks. And we were talking before this conversation about last week was pretty crazy for you all, and the number of new clients, more hours. You have all these folks that are relying on you. What I'm curious about for you, Brett, is what do you think has been that formula for success, if there is one, that has really enabled you and your company to really hit, obviously not the peak, but do so well?
Yeah, so I can kind of give a guess at that. I don't know that I have the exact answer. First of all, there are a number of successful home care agencies that are out there, and that are doing things the right way. And the right way and the recipe for that success, I think, is to focus on quality and try to make sure when we take on a new client, I feel like I'm personally committing to that family or that individual that we're going to provide the care and support that they need within the scope of our services. We're going to do the best job that we possibly can. And we're going to honor any of the commitments that we're making to them. If they start out and they just want support Monday through Friday, and then they add the weekends, we're going to cover that. We're going to figure out a way to make that work. The weekends tend to be some of the hardest for any agency to staff, but I feel like it's our responsibility to take care of the needs of a client when they trust us. I think focusing on quality is what we really try to make sure that we're doing. And the other thing, I think we really support our caregivers to the best of our ability. I love this business. One of the things I love the most is getting to know the clients personally and getting to know the caregivers. So I try to make sure that I'm spending a good amount of time out of the office on a regular basis. It helps me keep a really good pulse on the business. But if I had to kind of summarize it in that way, that's what I would say has led us to be successful. But I'm sure that there are other agencies that have found success maybe along the same lines or with a different approach.
Yeah, and there's nothing flashy about it. One of the things you said was honoring your commitment and the patients or the clients in this case. Right? Ultimately, I think it comes down to that trust that you build, because we're not just talking about with the clients themselves, but also with your referral partners in the community that are maybe sending you clients to discharge from the hospital. They have a problem that needs to be solved. Hey, can we count on Brett and Assisted Hands and his team to get it done? And just from the numerous conversations that we've had, you answer the call, right? You're the agency that picks up the phone, you solve the problem, you don't leave clients out there saying, oh, well, we couldn't find a caregiver this weekend, so we're just going to remove them from the schedule. But you're there till the late hours on Friday night solving those problems. And I think that sometimes, especially as the business grows, it can be difficult to keep the main thing. And it's like, oh, it's just one, just one client. But your commitment to making sure you're honoring your word to them. Hey, we're going to make sure your mom is taken care of, right? And it's not just the client themselves; it's their family.
Yeah.
And I get this deep sense of responsibility, I would say, that you take on. Even in our last conversation, you were mentioning there were times where you had to go out there, right? And
yeah, absolutely. And I mean, I do feel very committed, to the clients that trust us. And I want, certainly if we're working with a referral partner, I want them to know that when they trust us with their clients, or if it's, a community and they trust us with their residents, that again, they're going to get that same level of diligence. We're going to do everything we can to make sure we honor the schedule. We're going to meet their care needs. And the other thing that we do, certainly, that I think helps to build goodwill with clients is we're transparent. Certainly, things don't always go according to plan, and certainly our caregivers make mistakes. We make mistakes. we will always own up to those and do whatever we can to try to fix those as quickly as we can. And so we're not going to try to brush it under the rug or hide it. That's just not the person that I am, or the agency that we are. So again, I think those are all things that that do resonate with clients, with referral partners. And again, I can't stress enough that the caregivers, that the way that we try to support them, provide them with the information that they need when they're going to be working with a client. Another thing that we do is I have our, anytime a caregiver is scheduled with a client, we're going to call the caregiver, walk them through the care plan. We trust that they review the care plan in advance, but we want to make sure that they fully understand, that they have an opportunity to ask questions. And that really helps us make sure that we've got prepared people that are out there working. So I think that is also just something that the caregivers recognize, that they really feel like they're part of something.
Yeah, and I wanted to hit on that too, because there's a lot of moving parts, particularly as you've grown to the census that you have, the number of hours that you're providing care for. And I think the biggest moving piece, if I had to guess, is staffing and the caregivers, the scheduling. How have you been able to get your caregivers really to buy into that level of commitment, to providing good quality care to the clients that you're serving? How do you get them to buy into that?
So I think we try to be very mindful in just the interview process, that we start off by hiring really good people. We're looking for compassion first and professionalism. And those are the primary things that we want. Of course, we're looking to make sure that they meet all the requirements, so that they have the appropriate credentials. They meet all the other criteria that we have to meet as part of being a licensed agency. But we really are looking for compassionate people, because I don't think you can really teach somebody how to become more compassionate. And we want someone that's professional. Do they show up on time for their phone interview? Do they show up on time for their in-person interview? How are they conducting themselves on the phone? Sometimes we have people that we can tell that they're working for another company or privately with somebody, with a client, while they're trying to do the phone interview with us. That's not necessarily somebody that we want to hire, because if they're doing that somewhere else, they may do that when they're on the clock with us, and we don't want that. So we really are mindful of hiring people that truly care about other individuals. So when you start from that as the foundation, then there's not a lot that we really have to do that is, this is kind of also something that's a common sense answer. We certainly make sure that they've got the skills to work with a client. We make sure that they know the care plan. We make sure that they're as prepared as possible when they go. And we're already starting with a compassionate, professional individual. I take the time to get to know almost all of our caregivers. Whenever I'm around, I give them my business card, and I tell them if there's ever a problem, call the office, but if you can't get the office, call me. So I think it's just the regular engagement, and they get that same engagement from our nursing team. I want them to know that they are a part of a family of caregivers, and that's what really helps to get that buy-in.
Yeah. I think they always say the leadership starts at the top, and you as the owner of the company having your finger on the pulse of what's going on with all of your clients, all of your caregivers. And I think I don't know if it's rare or not. I would imagine that not every company of your size has that same level of commitment from the owner to that level of service. But I think, again, it comes down to that leadership and you leading by example, being out there. Because I remember you telling me, maybe you could share the story a little bit. Like, there's going to be service failures. We know that there's going to be somebody who's not happy with a caregiver, or something happens. But I think last time we spoke, you mentioned maybe a client had called you up specifically, and it was like middle of the afternoon on a Saturday, and you went out to solve the problem. Is there an instance maybe you can share something like that, or what it actually happened?
Sure. So I don't remember the exact instance that we might have talked about before, but those things happen on a regular basis where if something goes wrong. we work, and I'll be completely candid and transparent on this. Things don't always go according to plan. There was a time, I get a call from a client. This is the two things that I think we hear the most when clients aren't happy. It's caregivers spend too much time on their phone, and I'm perhaps guilty of that. I think maybe we all are as a society, but caregivers spend too much time on their phone, and certainly we want clients, we want our caregivers to be focused on their client and not necessarily on checking their email, checking their text messages, whatever that is. And then caregivers are very busy, and sometimes this could happen on our overnight visits, or it mainly is overnight. A caregiver nods off. If it's nighttime, it's dark in a house, they're there working with a client. I may get a call saying the next day that the caregiver fell asleep or not at all for just a few minutes. Those are things that we certainly try to address. I'm happy to make those phone calls to caregivers, and what I typically do is just explain to them, remind them the importance of what they're there doing to support a client that has needs.
Yeah.
And usually they're very receptive to that. Things don't always go according to the plan, and we certainly do have people that, we set a high standard and they don't always meet that standard. But I think that really is what is the measure of a good home care agency, is acknowledging that those things happen and trying to address them and fix them, rather than just ignore the feedback or really just do nothing with it.
Right, just sweep it under the rug, pretend nothing happened, because I can tell you, you're one of 100% of agencies are dealing with those issues.
Yeah, absolutely.
Right, and because we're talking about human beings, that things like that are going to happen. There will be a client of yours in the family that's unhappy about something, or there is a service failure, but I think it's how you respond in those moments. And I think that's you coming back to quality, right, as like what has been the success formula, and your commitment to that, recognizing there's always an opportunity to improve, and how do you respond when things don't go 100% to plans. Again.
Yeah, and the answer is always, we don't lower our standard. It's, hey, we recognize that something happened that wasn't what we want to do. Let's jump in and fix that. And if we give that feedback to one of our caregivers and they don't necessarily respond, they do the same thing over and over, well, then we've got an issue that we've got to address. And maybe we replace that person, or we have to do something that's more than just a supportive coaching conversation. But it's the standard has. If we want to deliver high quality services to our clients, then we don't want to compromise those standards.
Yeah, never lower the standards there. I mean, I definitely enjoyed our discussion so far. What I would say at this point is, if there is maybe a family out there that's thinking about mom or dad, and do we maybe need care? Do we need some help? Do we look at maybe going to like an assisted living facility? I guess what are the things that the process that they should be going through in their mind, or do you have any recommendations for them at this point on how they might address that problem head on?
Sure. So if somebody's realizing that they need support, first of all, I don't think that there's one answer that someone can have. I mean, there's a lot of different, it really depends on what their unique situation is. I also would recommend, if the resources are there, hiring someone like an aging life care manager, because they provide such a needed service to people in our area. And we're lucky in a place like the DC metro area that there are a lot of care managers that can help guide people to good providers, to facilities that have higher standards. They're able, because they're in those facilities on a regular basis, and certainly in retirement communities. So an aging life care manager can help with that quite a bit. But if a family is really just trying to understand, mom or dad need help, what do I do? And in those cases, then I think it could start with just a call to someone like us. It doesn't have to be assisting hands or Brett, but one thing that they could do is certainly a little bit of research. Now with tools, of course, you can do a Google search, but
Sure.
even with something like ChatGPT that can really condense a lot of that down, you can get a list of high-rated providers, and it really does start with a conversation. I get a lot of calls that say, "Mom or Dad need help. Here's the situation that's going on," because it's hard to give one specific answer, because sometimes families are dealing with cognitive impairment, and the way that we would work with a family that has dementia, it varies significantly. Is that person also, do they live by themselves, or do they live with a spouse? But it starts with a conversation with the provider to understand what those needs are. If they do decide that, yes, okay, we want to work with you, then that's when we would send a nurse to meet with them to have a more detailed discussion, and we would conduct that assessment so we can come up with a care plan, talk to them more specifically about how we would help. And then if they do decide, okay, we're ready to move forward, then we would be able to start putting caregivers in place to work with them.
That's perfect. And I think that's whether you're maybe a senior care manager, maybe you're in your discharge planner, you come across this information, you're a family member as well. It just starts with that conversation. As we kind of wrap up here, Brett, I guess where do you want people to find you? Like, how should they engage with you? I mean, obviously picking up the phone and calling Assisted Hands is probably the best way to reach you, but is there anywhere else you want folks to go to research more about Assisted Hands?
So if you were to look on our website, for one, there's a good amount of information about our agency, about my story as well, and the services we provide. A lot of times, though, this is a relationship business. We're building relationships with families, first and foremost, that we're supporting. And, that relationship, again, kind of starts with a phone call. So we're easy to find online. Just do a Google search, Assisting Hands. We also have another office, Assisting Hands Reston. Either one of those you can find us, you can call us. We're happy to have a conversation about what the needs are. And if home care isn't the right solution for someone, you kind of asked in your previous question, what if they don't know if home care is the right answer, assisted living is the right answer, if there are care needs. That's where I don't necessarily try to steer people only to home care. There are times where it may not be practical from a financial standpoint, one-on-one care that would be provided from a home care agency, especially if it starts to get to be 8, 10, 12 hours a day or more, it becomes cost prohibitive. And it might be a better financial decision for the family, especially if they feel like they need to conserve their loved one's money for another 5 to 10 to 12 years, then assisted living might be a much better way to do that, to extend the resources. And so I try to help people get to the right solution. And, again, that's where certainly I'm happy to recommend a few communities where we have good relationships, and we typically develop those relationships because we have an opportunity to work with them. We see how they operate. But there are so many different solutions that people have, from various types of retirement communities, memory care communities if that's needed, home care agencies. So I think a little bit of research and then having conversations with trusted people are the right way to get that information.
Yeah, right. And because, like as you said, you can do a quick Google search and find some good information on your website, but to be able to just talk with a professional that is dealing with these problems day in and day out to help himself, because again, it might not be Assisting Hands is coming out to see you, and maybe, just based on what you told me, I think you need to talk to this person, or I would recommend checking out here. It's not always going to be the right solution for them, but I think we're all committed to finding the right solution for the client, or maybe not even client, but for that individual and their family based on that discussion.
Absolutely. There's a lot of people that need support. We never worry at Assisting Hands that, oh gosh, we don't want to lose that client. We've got to convince them that home care is the right answer, even if that may not be the right answer and it would be better for them to go to an assisted living community. I would rather help them figure out what the right solution is, weighing various factors, like the care needs, like the financial constraints they may have, and then helping them by making recommendations or connecting them to other professionals that can get them to the right place.
Absolutely. Brett, thank you so much for taking the time. So if anyone is out there, maybe are considering, does mom or dad need help? Maybe I need help, or if you're a care manager or you work in senior care, you're looking for a really high quality agency to help your clients or patients, reach out to Brett at Assisting Hands. His team does a great job, and I know he's committed to doing the right thing.
Yeah. TJ, thank you so much.
Yeah, cool.
Cool.